I came to Leicester when I was 18 for university, for medical school, and my husband is also a doctor and we've stayed here ever since. The reason why we stayed was because we love Leicester, we love the cosmopolitan feel of it. There's a real good challenge working in general practice in the city. There's lots and lots of different presentations.
Its multicultural, diverse population always makes it a very exciting place.
Geographically, I think it's fantastically located, so you can go to any part of the country from here. Within 2 hours, you've got 70% of the country.
And you have all the amenities of a big city without it actually being overcrowded.
It's a really lovely place to bring up a family. So we've got 2 young children. You can get a nice house in a good catchment area, a beautiful home for not bad price.
Leicester offers lots of museums like Richard III, which is globally popular.
There's amazing green spaces.
And I find myself to be in a safe environment in Leicester.
It's actually small enough to feel like home. So I'm able to get about as I need to without any issues with transport. But actually, if I want to go out for dinner or go out for drinks, there's an amazing social life out there. Great shopping, which also helps.
If you're a sports fan, you can think about Leicester Tigers, which is one of Europe's finest rugby clubs. And of course, we shouldn't forget about the Leicester City Football Club, which won its title in the Premier League.
Schooling's very good, hospitals are local, so I think it does lend itself to a very good quality of life, and I think I can safely say that we do enjoy a very good quality of life as doctors in Leicester.
After I did my GP training, I did consider moving to London particularly to pursue my career. Actually, the opportunities in Leicester are vast. You have got so many opportunities to work either as a sessional GP or as a partner if you want to, or other roles as well, whereas it might be teaching roles or appraising roles, both of which I do and really enjoy. I'm not sure you would get the same opportunities in other areas. I'm sure that they are available, but they're so freely available here. I thought that it would be an excellent place to stay.
During my 8 years of surgical training, I moved around the country a lot. So I started my training in Redhill in Surrey, and then I moved to Guildford, and then I moved to Crawley. From there I went to West Midlands to be a surgical trainee in all of Birmingham. Then I got my registrar jobs in Brighton and Portsmouth and a bit in London. And then I came up to Leicester. And now coming to Leicester, I feel at home now, and I won't move to any other city at present because Leicester has given me a lot, and I feel that it has that capacity to provide me with more opportunities.
Working in Leicester is helping me to develop my own personal career aspirations. I'm a fairly junior GP, so I only finished my training 18 months ago. So, I think it's quite a big step going from becoming a trainee, going straight on to partnership. But then in that 18 months, I've developed other roles within the local hospital as I do some cardiorespiratory work there 1 day a week, also do some out of hours work. I'm also developing other things at the practice. And I think these opportunities are very unique to Leicester as a city just because of the way healthcare services are shaping up here. The hospitals are actually very close, and so the city actually works as one big healthcare unit, and I think that's very apparent in the work that you do day in, day out.
There's a good variation in all these specialities in the hospitals here. So with the training in general practice, you can get a taste of each speciality. So you can take that eventually to your GP practice. For example, I have an interest in chronic kidney disease, so I've brought that to the places that I've worked in the past. I'm now building up my minor surgery skills here.
I completed my diploma in ENT and started working as a gypsy in ENT in one of the community hospitals. And during this time, I also was able to complete my do a training in medical legal law and ethics, which allowed me to work on the CCG governing body. And I'm currently the first female on the City CCG governing body.
I've worked as a sessional GP, I've worked as a locum GP and as a GP partner, as well as a GP appraiser. And having all of those opportunities has been fantastic. And I think being in Leicester has been paramount to that, really.
That transition, moving on from trainee to becoming a partner, was challenging, and there aren't many doctors who actually take on that challenge, but of those who do, there's more than enough support available. So I had some of my peers to support me through that process. I think the local CCG also helped us through that process, and so whilst it is a bit of jumping in the deep end and learning how to swim, which I don't think anybody should be afraid of, there are enough people there to lend a hand of support when that is required.
You get the opportunity to propose what you want in your training or career. For example, if you need training in coil implantation or surgery, you'll get the opportunity to do that.
The patient population is very unique in the sense that it's a multicultural society that we're working with, and that presents itself with unique challenges on a day-to-day basis. So the biological, psychological and social factors that patient presents with and their own respective health beliefs are very different, and as a GP that is a challenge.
But it's a really good challenge, and also you feel as though you're making a real difference to these patients, which overall is really, really satisfying.
It's a great place to work. I wouldn't choose any other place.